All right, we're going to get started here. Thank you for joining us today for the Cancer Screening Toolkit virtual launch. So we're going to record today's session. And if you have any questions as we're talking, we encourage you to put them into the Q&A, and we'll have some time at the end to address them. We have noted the questions that came in through registration, and we'll do our best to acknowledge those today. So CancerCare Manitoba is on the traditional land of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, as well as the homeland of the Red River Métis. CancerCare Manitoba acknowledges that colonial practices and policies have impacted the health and well-being of generations of First Nations, Métis, and Inuit, who continue to experience inequities and obstacles in accessing healthcare, including cancer services along the cancer continuum. At Cancer Care Manitoba, we respect the spirit and intent of the treaties and treaty making and remain committed to working in partnership with First Nations, Métis, and Inuit peoples in this spirit of trust, reconciliation, and collaboration, while also improving cancer control and outcomes for all Manitobans. And I feel privileged to work and to live on this land. So before we get started, we want to take a quick poll to get a sense of your comfort level talking about cancer screening out in community. So a couple of statements here, just want to know where you're at with them. One is I know how to access cancer screening tests in Manitoba. So feel free to select some responses there. I know where to go if I have questions about cancer screening. And then finally, I feel confident promoting cancer screening. So we're going to take this survey at the start and at the end just to get a sense of where people are at to see if any of this changes for folks. All right, thank you so much. Okay. All right. So our goal today is for health promoters to be able to find more information about cancer screening, to download and order cancer screening resources, and to facilitate access to cancer screening for people that you connect with in your communities. So if you have questions, again, type them into the Q&A section and we'll have time at the end to answer them. So just to give you some background on how we got here, we did a needs assessment in the summer of 2023 to health promoters in the province, and we were trying to determine what resources were already being used that worked well, and what resources would be helpful to have from Cancer Care Manitoba screening. We had 50 responses that came in from health and wellness facilitators, community engagement liaisons, community connectors, chronic disease educators, respiratory therapists and educators, public health nurses, pharmacists, and dietitians. So there was a pretty wide variety of different people who had responded. We obtained feedback from over 50 communities of practice through a survey and through in-person discussions. And so these conversations really helped to direct the items that were selected for the toolkit and really are the reason that we're here today. So thank you for all the input. Today, we're going to review how to access screening and the toolkit and how to navigate conversations around cancer screening. So before we get into too much detail, we want to share with you a video that has our three main program videos on it. It's a compilation, so they just play one after the other. And then they're available on our website. So I'm just going to show you where that is. So if you go to the Cancer Care website and you go to screening and you click on resources, you'll get to this page here. If you just scroll down to education videos, the compilation is the first one right here. So it has all three screening programs. So we're just going to share that with you today.
You can take action to prevent cervical cancer and catch it early. Cervical cancer is caused by HPV, which is also known as the human papillomavirus. Over 80% of Canadians will get an HPV infection. Most people will never have symptoms and will clear the HPV infection on their own. But in some people, HPV can cause abnormal cells to grow on the cervix that may turn into cervical cancer. The best ways to prevent cervical cancer are to get vaccinated against HPV and get screened for cervical cancer every 3 years with a Pap test. The Pap test checks for abnormal cells on the cervix. Most women, trans, non-binary, and gender-diverse people with a cervix who are aged 21 to 69 and have ever had sexual contact should be screened regularly with a pap test every 3 years. Sexual contact, either wanted or unwanted, includes skin-to-skin contact between one person's genital area and another person's genital, anal, or oral area, as well as sex with shared sex toys. Here's what you can expect during your pap test. On the day of the appointment, wear an outfit with a separate top and bottom. You should also bring your Manitoba Health card. When you enter the clinic room for your appointment, your healthcare provider will ask you to remove your clothes from the waist down and cover your legs with a sheet. You will then be asked to lie on the exam table and place your feet in footrests. Your healthcare provider will insert a speculum into your vagina and open it to examine your cervix. The speculum may feel cold, and you may hear a clicking sound. This process can cause some discomfort. If you feel pain or have any questions or concerns during the test, let your healthcare provider know. Next, your healthcare provider will collect cells from your cervix using a small broom, and then remove the speculum. The test is now done. Your sample will be sent to a lab to be checked for abnormal cells. The test result will be sent to your healthcare provider in a few weeks. You can call them to ask about your result, or you can request a copy from Cervix Check. If the result is normal, it means that no abnormal cells were found. Cervix Check will send you a letter in 3 years to remind you to book your next pap test. If the result is abnormal, it means that you need to follow up to understand and possibly treat the abnormal cells. In some cases, your pap test sample will be automatically tested for HPV. Abnormal test results are common and do not necessarily mean that you have or will get cervical cancer. If the abnormal cells are treated, it can stop the cells from growing into cancer, so it's important that you attend all appointments. To make an appointment for a pap test, call your healthcare provider. If you do not have a healthcare provider, you can find providers who do cervical cancer screening at cancercare.mb.ca/cervixcheck. If you want a female healthcare provider, need help with mobility, or need an interpreter, ask when you book the appointment. Remember, the best ways to prevent cervical cancer are to get vaccinated against HPV and to get screened for cervical cancer every 3 years with a pap test. If you have any questions about cervical cancer screening, call Cervix Check at 1-855-95-CHECK or visit cancercare.mb.ca/cervixcheck.
When I received a letter in the mail from Breast Check, I thought about it for a little while. It was a little easier to put it aside, but then I decided it was best for me and my health, and so I called to make an appointment. When I first heard about going for a mammogram, I wasn't quite sure whether that was an important thing to do, but I did a little bit of research and found out that yes, that is part of taking care of my body, and one way of taking care of my body is by having regular checkups, and a mammogram is one of those regular checkups. I looked online to see where the closest mobile clinic was to me, and then that's where I made my appointment. When I arrived at the mobile clinic, I'd never been there before, and it was very warm feeling in there, beautiful, very nice equipment, and I was made to feel very comfortable.
When a lady comes to the mobile clinic, she'll enter them through stairs or the accessible lift. Once she gets on the truck, a technologist will greet her and ask for her Manitoba Health card just to verify her information.
I was a little anxious because I wasn't quite sure what was going to be happening. The technologist I had was very kind and walked me through and explained everything that she was going to be doing, so I didn't have to wonder about what was going to happen next.
I help the clients through the test by explaining exactly what I'm going to do. It is all based on communication, but we always tell the woman that they are in charge of the appointment. The mammogram will be performed with 4 images. So there's a little bit of pulling and compressing, but the compression itself will only last about 30 seconds at the most. As soon as that exposure is done, the paddle just lifts right off them.
After my mammogram, the technologist informed me that my healthcare provider and I would be receiving results in the mail. After the mammogram was finished, I was relieved. It went better than I thought it would. It can be quite a scary experience because you don't know what you're going to find out, but it's better to know so that you can take action. It's an important thing to do for your health, and it's a simple thing that you can do.
Colon cancer is one of the most commonly diagnosed cancers in Manitoba. Colon cancer starts from small growths called polyps that may appear in your colon or rectum. You can have polyps for many years without ever knowing it. Most polyps do not turn into cancer, but some can. The great news is that colon cancer can be prevented by removing polyps. Fortunately, there is a quick and easy way to check for colon cancer in your own home. It's called the Fecal Immunochemical Test, or FIT, and it works by finding hidden blood in poop or stool, which can be a sign of polyps or cancer. The test is easy and can be done at any time of the day and in the privacy of your home. There are no dietary or medication restrictions, and only one sample is needed. Colon Check mails FIT kits to eligible Manitobans. When you receive your FIT kit, you will find a FIT tube, an instruction sheet, a return form, a stool collection paper, a plastic bag with absorbent pad, and a return envelope. Before doing the test, check that the return form and FIT return label have the right information. If there is any incorrect information, call Colon Check to update your health record. Next, complete the return form by providing your phone number, your healthcare provider's contact information, and your family and personal health history. Then you'll need to write the sample collection date on the FIT return label found at the top right corner of your return form. Peel off the label and stick to your FIT test. Then write the sample collection date on the return form. After you finish filling out the return form, go to the toilet, pee, and flush. Next, unfold the poop collection paper and place it lightly on top of the water. Then, take a poop. Once you have finished, open the FIT tube by twisting and removing the lid. Next, swipe the stick through your stool. Make sure that you collect enough of your sample to cover all of the grooves on the stick. Insert the stick back into the tube, making sure it snaps closed. You can now flush the toilet and wash your hands. Now that you've collected your sample, wrap the absorbent pad around the tube and place both into the plastic bag. Close the bag and place it along with the completed return form into the envelope. To return your completed FIT, drop it off in person at a Canada Post Office or a shared health lab. Refer to the FIT instructions included in your kit or specific location information. Within a few weeks, Colon Check will send you the result of the test. If your result is normal, Colon Check will send you another FIT every 2 years as long as you're still eligible. If your result is abnormal, you'll need a colonoscopy. Colon Check will help you through this process. It is important to monitor your health for any signs or symptoms of colon cancer. Even if your FIT result was normal, you should talk to your healthcare provider if you experience any of the following symptoms: blood in your stool, persistent abdominal discomfort, persistent changes to your bowel habits, or tiredness or weight loss that you cannot explain. Checking for colon cancer is easy and can be done very quickly. To get more information about colon cancer screening, visit cancercare.mb.ca/coloncheck or call 1-855-95-CHECK.
All right, so that's the series of videos, and you're welcome to use those. They're on our website. Just gonna share with you. Keep going here. Everyone can see my screen. Okay. All right. So we're just gonna talk a little bit what cancer screening is. So, um, sorry, cancer screening is for individuals who have no signs or symptoms of cancer, and that's often misunderstood because we're part of cancer care. People think people who have cancer, but actually cancer screening is for people who have no signs and symptoms. And it's really intended to prevent some cancers by finding those early changes and treating them before they develop into cancer, and to find cancer early when treatment may work better. But cancer screening really works best when it's done on a regular basis. It's not a one-time test. It needs to be done every few years for it to work properly. So once a person becomes eligible by their age, CancerCare Manitoba will send a letter to invite or recall them to participate in cancer screening. So to follow in the next couple of slides are some of the steps that come after somebody receives that letter from us. So for breast check, people who are eligible to participate in breast cancer screening should call breast check to book an appointment at any one of our 6 breast check clinics. The number is 1-855-952-4325, and interpreter services are available upon request. Clinics are located in Brandon, Boundary Trails, Thompson, Winnipeg, and we have 2 mobile clinics that tour the province on a 1 to 2 year cycle. And all the clinics are listed on our website at cancercare.mb.ca/screening. So that's how you can get to the clinic listing. And the number to call to make an appointment is the same regardless of where the clinic is located. And there's no referral that's required to get a screening mammogram appointment at Breast Check. So those eligible for cervical cancer screening should make an appointment with their regular healthcare provider, or they can contact Cervix Check to find a Pap test clinic nearby. So you can contact Cervix Check in a few ways. So one is you can visit our website at cancercare.mb.ca/screening and to find a Pap test clinic near, or you can call Cervix Check at the 1-855-952-4325 number to get help finding a clinic using that online map. And again, interpreter services are available upon request. For colon check, a kit is sent to an eligible person at their home once they turn 50. If the person receives that kit and they choose not to complete it at that time, or the kit expires and they want to complete it in the future, they would need to request a new kit from Colon Check, and that can be done online on our website, cancercare.mb.ca/screening, and clicking on that green button, or they can call Colon Check at the 1-855-952-4325 number. And again, interpreter services are available upon request. So Colon Check will send instructions on how to complete the kit in English and French, and those are mailed in the package that comes to the home. There are also instructions on video that can be viewed at cancercare.mb.ca/colon check in English, French, Ojibwe, and Cree. So just a few reminders when someone does the kit to make sure that they send the fit and the return form back with the kit. So I'm going to turn it over now to one of our other health educators, Shauna.
Hi, good morning. I'm Shauna Fay, a health educator here with Screening and Prevention. And I worked for 13 years at another community health center. And it was always a good day when I found a toolkit of tools that I could download, print, and share with clients. So I'm really pleased to share our toolkit with you so that you can take what works well for you and for the populations that you're working with. So the first thing is to find the toolkit. What you're going to want to do is head to cancercare.mb.ca, and then you're going to click on screening. When the button comes down, click resources, and then it's the Promote Cancer Screening Toolkit. So I'm going to go through what is in the toolkit so that you know what's there. So the first thing you'll see are the cancer screening posters. That's going to open a file that contains 12 posters. They're for breast, cervix, and colon check, and these are in French and English. So you can print out the ones that best suit your needs. So those ones are really popular. And then the other thing that we really like are the tear-off pads. These are called the cancer screening tear-offs. They're the smaller handout. These describe the population of each screening program. So this handout details the age cohort, the gender or body part being screened, how often the screening test is recommended, and how someone would access screening. So you can click on the link for that PDF, But even better, you can order a pad through the resource order form. If you do order a pad, what we send you is a little pad of 50 with English printed on one side and French printed out on the other side. So if you can only have one resource because space is limited, the tear off pad sort of is the one-stop shop of all of the screening programs. All right. Next, we have illustrated guides. So these are called the Cancer Screening Illustrated Guides. If you click on that, it opens a file that contains guides on breast, cervix, and colon cancer screening in English and French. These can work well if you're serving an individual or a community that benefits from visuals. These can help engage and prepare folks for screening and can assist you in effectively communicating next steps. So if those are useful to you, they are available for you to work with your folks. Leslie just played for us the 3 cancer screening videos. And I just wanted to share a little tip that if you are viewing these on YouTube and you go to the closed captioning, if you hit settings and then go to the subtitles area on YouTube, you can go to auto translate, and there are a large list of languages there, and you can hit whichever language you may need it in. The narrator will still be speaking English or French, but the subtitles will come up in another language, and they're actually pretty good. So if you need that, that's available through YouTube. And then these are good for, you can download them and share them. You can show them in a group. You can show them at a tabling event, or if you have a waiting room, these might be suitable for that. Next up, we have been asked sometimes for a radio script. So we've created one for each screening program in English and French, so that if there's interest, you can read it on air, or you can have a community representative say the messaging in a simple and concise way. So that's available to you. And then we also know that people love games and that presentations or workshops aren't always a good fit for every group. So we've created a cancer screening bingo for these occasions. It delivers key messaging on all 3 programs in an interactive way that we really hope adults will like. It comes with bingo sheet printables and a PowerPoint PDF with all of the prompts. And then the best part is that we've designed it in a way so that every player is a winner when you call that last prompt. Asterisks here, prizes not included. So that's where you can get creative and get fun. Speaking of fun, we've created also some crossword puzzles in English and French that you can download and print as another way for people to engage in this information. All of the answers in the crossword puzzles are found in the core program brochures, and they're also at the bottom of the puzzle. So these can work well as handouts, and if you're tabling or have a display of some sort, this can also generate a little bit of interest and get people to come visit you. All right, next in our toolbox are some demonstration kits. So these are only for demonstration use so that you can describe what tools are used during a pap test. But you can order a kit from us and we will send you a speculum so that you can show people what is a speculum, what is that for. We have included a little rubber model of what a cervix looks like, the broom that's used at a pap test, and then the little vial container where the broom goes into. And then there's a little explanation of what happens at the pap test. So if that is useful for you to explain and normalize what happens at a pap test for the folks that you're chatting with, that's available. Feel free to order that. And then in similar fashion, we have the same thing for the fit kit. So some people, it's much easier to understand if they can see it and feel it before it happens. So we can send you a demo kit. Everything that comes in the kit is included. And then You can open this up and show people how easy and how not scary or gross this is. So we like to do that. People really like to see this because if they're used to the old style of test, this is very different from them, and it looks much simpler. So that is available for order under the FIT demonstration kit. So those are all of the sort of tools, but I wanted to show you something else that we've developed that you can access online, which is our cancer prevention and screening decision aid. So this is a bit of a snapshot. If you head to practiceprevention.ca, and then if you click that beige button right in the middle that says decision aid, it's an online questionnaire that asks a series of questions about risk factors for cancer, and then it generates recommendations to help a person know how to reduce their risk based on the information that they've inputted. And just so that you know, no information is saved or collected on the website. It is just used to generate some guidelines by the end. So I just wanted to give you a bit of a snapshot of the types of questions. And then once you get through it, I did a little practice one with like a fake age and a fake demographics and stuff. But this is what it generated at the end. So it let me know that it's best to avoid alcohol. I had inputted that the person did drink alcohol during the week. So it gave me the tip that it's best to reduce alcohol because the less you drink, the more you reduce your risk. But they were doing a great job on stopping smoking. So they got a little boost there. And then it goes through each of the 3 program areas. So this person was not eligible for breast cancer screening, but they were eligible for PAP screening, and they were eligible, but not currently due for a FIT test. So it can really walk someone through what is right for them in that moment. All right. I would like to also let you know that we have community engagement liaisons. So in regions other than Winnipeg, we have community engagement liaisons who offer information about cancer supports and services. So the liaison builds relationships in the local communities, shares culturally responsive information, and connects with communities to increase knowledge about cancer prevention and early detection. Joyce will tell us more in just a second about her role at Prairie Mountain Health as a community engagement liaison.
The role of the community engagement liaison is to build relationships at the community level, increase awareness about cancer risk reduction, and help communities become more knowledgeable about cancer services and resources.
Thank you. So that was Joyce, but we've also got Crystal in Interlake Eastern Health. So if you're ever interested in working with one of our community engagement liaisons, feel free to get a hold of them. If we move through this too quickly today, you can also get in contact with us and we can put you in contact with them. But they're a great resource to have. All right.
The role of the community.
Oops, there we are. There we go. So we developed a bit of a summary on how to access cancer screening as a cheat sheet for facilitators and educators. This isn't a public-facing document, but more of a summary for your own reference. This sort of breaks down that tear-off sheet in just a little bit more detail. So if you are interested in having this in your back pocket, you can email us and we can send you a PDF copy. We don't have this one on our website, but if you would like the inside scoop, we would be happy to get that to you. Otherwise, the tear-off sheet probably will just get you through the nuts and bolts of it. Because sometimes chatting with people about cancer screening can be difficult. So we actually have a few tips about navigating those conversations. So the first thing to remember is that cancer screening is a choice. and that participation is optional. Cancer screening isn't for every person who's eligible. Sometimes the harms outweigh the benefits. For example, a person might not be willing to proceed with follow-up testing under any circumstances. So that person might not be a good candidate, even if they're eligible. The second thing to remember is there is usually a reason for resistance, so stay respectful if you're chatting with someone who's not interested in cancer screening. If a person is strongly opposed to participating in cancer screening, there's usually a story. Maybe they've had a previous negative encounter with the healthcare system or even a screening test, or perhaps a loved one has died of late-stage cancer. There could be any number of reasons. So we know that you'll stay respectful and you'll acknowledge their situation. Sometimes saying something like, I can appreciate you're gathering information to make the best decision for you, can lead us into the next tip, which is keeping the door open. So even if a person is not willing to engage in cancer screening, the conversation that you're having with them might help them develop enough trust that down the road they may consider it. We like to tell people, listen, it's your body and your decisions. If you ever change your mind, you can get in touch with us online or on the phone. So always just leave that door open and plant the seed that they're welcome to cancer screening. All right. And then the last thing that I just want to chat about is, oh, you don't have to have all the answers. Isn't that wonderful? So we often refer to, you know what, it's best to have this conversation with your healthcare provider. They have more of the details and histories. You can refer together to CancerCare Manitoba resources. You can email the screening at cancercare.mb.ca. That email is available to you. It's also available to the clients or patients or community members that you're chatting with. And there's no shame in opening up the brochure and saying, you know what, let's look that up together. That way you're actually teaching them where they can find the answers when they're at home and don't have resources with them. And then last but not least, if you're chatting with people who access information online, please share our social media pages with them. We've recently changed a few things about how we post, and a lot more people are interacting and sharing screening information that way. So to see posts about cancer screening programs and the Breast Check mobile clinic locations, you can follow and share on Facebook, on X, and on Instagram. And then if you would like us to tag you on posts, get in touch with us. We would love to interact with you in that way and make it easy for you to share online if that's a way that your community spreads information. So I hope that you enjoy the toolbox. It is designed for you. Take everything or take as much as little as you like so that you can have conversations about cancer screening with the clients that you serve. I'm going to pass it to Nefemi. She is also a health educator here at CancerCare with screening and prevention.
Nefemi, we can't hear you.
I muted myself. Sorry about that. Thank you, Shauna. Hello, everyone. My name is Nifemi Adeoye. I'm also an health educator here at CancerCare Manitoba. We're so excited to have you join us today. I would be addressing some frequently asked questions on cancer screening, some of which were submitted by the registrants. If you have any questions, please drop them in the Q&A section. Okay. So the first question here is, just give me a second here. Okay. Okay, I missed the breast check mobile clinic in my community. Where can I go for my mammogram? So you can visit our website at cancercare.mb.ca/screening. You can also call the program number to find a breast check clinic. I do not have a family doctor. How can I get a pap test? Again, you can visit our website. You can find a pap test clinic on our website. It would show you the pap test clinics that are closest all the way to farthest from you. You can also call the program number. Service check would help you find a clinic as well. Why does the breast check mobile clinic not come to my community? So there are so many factors that we have to consider before we can set up a mobile clinic in a community. So some of the factors that we always look at includes physical standards to assure safety of staff and clients. So this include space for the truck to enter and exit, access to diesel fuel, flat surface to park, and this surface must be able to support a 31,000-pound truck. And there must be reasonable highway access, access to washrooms, and cleared parking for clients. And other than physical standards, we also consider access to power sources. Community size needs to have enough people to fill a minimum of 2 to 3 days of appointment, and also community contact to support appointment making process. So all this to say that it's not a quick or simple decision for us when we make that decision of which community to go to. Are there any dietary or medication restrictions to follow before and while I do my feed kit? So there are no food or diet or medication restrictions before completing the feed kit. You can complete that as required. My computer is just a little slow today. Some people might be worried if they have diarrhea, like losing watery stools, can they still collect a stool sample? Yeah, it's absolutely fine to go ahead and collect a sample even if you have diarrhea. I forgot to include my return form with my completed test. Would I have to redo the test? So unfortunately, the lab would not be able to analyze the test if there's no return form included. So call the program number, colon check, to inform them that you did not include that return form with your test. And my colon check kit expired. How can I get a new kit? So again, you can visit the website. You can request a new fit kit on the website, and colon check will send a new one in the mail. Is there another way to find colon cancer? I do not want to do that gross test. So understandably, some people might find swiping your poop to be gross. It's understandable, but thankfully it's simple and it's quick. The best way for people at average risk age 50 to 74 to screen for colon cancer is by doing the FIT. We used to have a 6 sample test and we've recently changed that to 1 sample. So a lot of people do prefer the 1 sample. They've noted that it's relatively easier for them to complete that sample test. And their screening test for prostate or ovarian cancer. So at this time, we only have screening programs for breast, cervical, and colorectal cancers. We do not have any other screening programs outside of these three. So we encourage people to talk to their doctor about their individual risk, or if they're worried about other cancers, so the doctor can help determine the best step. And why do we need to do the screening? So cancer screening can help to find any early changes, so they can be monitored or treated. And also cancer screening can help to find cancer early, and that can, mean more treatment options and better outcomes. And just like Shauna mentioned before, it's very important to remember that participation in cancer screening is a personal choice. We cannot enforce people to do cancer screening. It's totally a personal choice. We're just there to provide, information for people to make an informed decision. And when am I due to do the screening? So you will get a letter in the mail from each program when you're due to be screened. If you're not sure, you can also call us by phone and we can let you know when next you're due for screening. Why do we have to wait until a certain age? So each screening test has been targeted at a specific age range to get the maximum potential benefits of that test and minimize the potential harm. So this is just to ensure that the potential benefits outweigh the potential risks of the test. And why do I have to do this if I'm feeling great? This is a absolutely wonderful question, because the best and the only time to screen for cancer is before you ever have any signs or symptoms. And why are there more cancers now compared to 20 or 30 years ago? This is actually a really good question, because the overall incidence of Canada and the associated death, they're going down, but it's still projected that there would be new cases and deaths, they would increase in 2024. This is due to the growing and aging population that we have in Canada. Now I would pass it over to Wheels. Thank you.
Hi, everyone. Good morning. I am Uyursa, and I'm also a health educator here at CancerCare Manitoba. Okay, so I really want to appreciate everybody for joining in, and thank you for eagerly listening to all that we have to present. But right now, we want to take another poll. And this is just to help us know where you are right now after taking or listening to everything we've had to say here today. So if you don't mind, please take the poll you see on your screen right now. We would love to hear from everyone. The first question says, I know how to assess cancer screening test in Manitoba. Just choose any of the options. The next one, I know where to go if I have questions about cancer screening. And then lastly, I feel confident promoting cancer screening. All right, we'll give you a few minutes to just take that. And then, okay. All right, so we just want to show you where you can find the toolkit again. I know we've talked about this severally, but we want to be sure that you know the right place to access this toolkit. Once you go to cancercare.mb.ca/screening/resources. There you can find the toolkit. It's highlighted here. Go to screening and then down to resources. And then you have all the toolkit that we've talked about right there. All right, so if you have any questions after today, please feel free to contact us by phone. The number is 1-855-952-4325. You can call us, and also you can email us at screening@cancercare.mb.ca. You can reach us there and we'll be sure to answer your questions, okay? All right, we've talked so much, we would want to give you a chance now to talk. I see in the Q&A that we have some questions that have been put in there. If you still need to ask questions, please, this is the right time to go drop in your questions and we'll be sure to answer them for you. All right, I would want to go to the first question I see here, and it says, as a medical clinic, can we request the mobile breast check clinic to come to our clinic so we may have an open clinic for our local communities? I would want to invite Kyra to answer the question.
Hi, everyone. I'm Kyra Kawako. I am the Education and Prevention Lead with our Prevention and Screening Department here. And I think Nefemi spoke to this quite well, that there is a very long list of criteria that are required to be met for us to have a clinic scheduled in a community. However, that being said, if you think that those criteria could be met and we have an unmet demand there, feel free to reach out. We'll be able to connect you with the appropriate person to dive into some of those criteria a little further to see if that's something we could make possible.
Thank you, Kyra. I have another question, and I would like Leslie to take that. It says, how long will the results take? So I'm sure this person means after screening, how long will the results take to get back to the person screening?
So for breast check and colon check, a phone call would come if the result is abnormal. And if the result is normal, then a letter would come, and that would come within 2 weeks' time from the test. For cervix check, the result letter only goes out in specific situations where the result is more concerning. But otherwise, you could contact your healthcare provider to get the results. That there's a range there, can be anywhere from 2 to 4 weeks, sometimes even longer. You can also request on our website your screening history, which would have a result on it. So that's at the cancercare.nb.ca/screening, and you just select cervix check, and then there's a drop down there that says send me my pap test results, and then you just fill out that form and we would send it out to you.
Awesome. Thank you, Leslie. I have another interesting question here, and I would like Kyra to attend to this, please. It says the tear-off reminder sheets are great to give to patients. I'm glad you guys find that that's a great resource. It's been unavailable frequently. Is that something that will be more available in the future?
So I would say that our intent is always that that would be available in the future. I will kind of highlight though that every time we have to make a change to it. So for example, we foresee that there's going to be changes to our breast cancer screening guidelines, and at which case we will need to update our resources. So although we will intend to be able to plan and have that replaced within the same time period, that could be a time that I would maybe say we might have a bit of a gap, but that would also be my flag to everybody to, order within reason instead of stocking up, because we know that things are exciting, changes happening, and we want to make sure that we have new resources for you when things change. And so please also keep an eye out. If Leslie, this is my question for you, is if those who've registered for the website would also have the opportunity to register for our newsletter so that they will be informed when those changes are made.
So people who registered for the webinar had an opportunity to indicate if they wanted e-news, so they'll be added to the list. But it's always best just to check back to the website as well. We don't often send out an email if there's something that's out of stock and now in stock. But just to check back to the website would be the best way. Yeah, we update it as soon as we can.
Thank you, Leslie.
All right. Thank you, Kyra. Thank you, Leslie. So just so you are informed, it's always good to go back to the website. All right. I have a question here for you. Nifemi, I would want you to answer to that. It says, can I request a female clinician to do my pap test?
Yes, so you can visit our website again, cancercare.nb.ca/screening. You can find a pap test that has a female provider listed. That information is included on the website. You can also call Service Check. They can help you find a clinic that has a female clinician. So other information on our website also includes if the providers speak like other languages, or if the site is wheelchair accessible, or also if there's an attendant to help transfer to an height adjustable exam table. So we always do encourage that you call ahead, call these clinics just to confirm that information, just in case they have anything that's been updated.
Okay. Thank you, Nifemi. I have an interesting question here. It says, my husband just turned 51 and has not received the colon cancer screening kit. Do people sometimes get missed? Shauna, I would want you to take that, please.
Sure. Hi. So the way that we get information in our registry is through the Manitoba health cards. So we always encourage people to keep their health card information up to date. If there is an old address listed on the health card, then we won't have your current address. But when you are right, when someone turns 50, we will send you an invitation to the screening test or tests that may be right for you. Keep an eye on the mail, but if he hasn't gotten his kit, he is welcome to phone colon check. We can send him out a kit and get him set up. So sometimes people do get missed. We would really love for people not to get missed. So if you feel like he's been missed, we would love to hook him back up.
Okay, thank you, Shauna. So Whoever asks, please just ask your husband to give us a call. The same number, 1-855-952-4325. Or otherwise, you can also go online and request a fit kit for yourself. All you have to do is go to the website, go down to screening, hit the colon check, and then you will find request a fit kit. So all you have to do, fill the form, and we'll sure send you a kit. Okay, next question. It says here, my family doctor mentioned recently that Manitoba is going to roll out an home cervical cancer screening kit. Is this the case? And if it is the case, what's the timeline? Leslie, could you answer to that, please?
Sure. We did actually do a pilot for a self-collection device. It looks like this. It's a swab that goes into the vagina. So that pilot has finished and it was very successful. Patients who did participate, who were randomly selected, were very pleased with the whole experience. And so we're in the process right now of sort of evaluating what the future of cervical cancer screening could look like in Manitoba. And that at-home screening kit is definitely part of the conversation. So we have a project coordinator who is coordinating opportunities to hear from stakeholders across the province about what the future of cervical cancer screening should look like. So once that project is done, then there will be probably some more information about what that might look like. So it may include that self-screening kit. We don't yet know. So stay tuned for more information on that.
Okay. Thank you, Leslie. All right. Tyra, this is for you. Why should a patient, should a patient without a family doctor do to assess cancer screening?
So we have a variety of different ways that we can access cancer screening directly. For example, with breast check, you can give us a phone call. For colon check, you can request online or give us a phone call. And with cervix check, you can find a Pap test clinic in your community, either through our website or again, by giving us a call.
All right, I hope that answers your question. But if you feel your question wasn't answered properly or to your understanding, please feel free to put it in again in the Q&A chat and we'll respond to that. All right, I would want Leslie to answer to this. Given the new direction to now have breast cancer screening change from 50 years to 45 years and then to 40 years, will more communities be added to the mobile clinics going forward?
It's a good question. So currently, Breast Check recommends that most women aged 50 to 74 have a screening mammogram every 2 years. And some trans, non-binary, and gender diverse people may also be recommended to participate in breast cancer screening. So in December of 2024, Breast Check will begin adding more appointments for those aged 50 to 74. So these appointments will be available on the mobile screening clinics and in Winnipeg, and will focus on areas and on people for whom it's harder to access breast screening. As we build that capacity, additional screening equipment will be added to further expand services throughout the province. So to make that appointment, it's the same information that won't change, the 1-855-952-4325, and there's no referral required. In December of 2025, Breast Check will begin accepting breast screening appointments for those aged 45 to 49, and resources will be available to help with that decision-making process around that time. And then in December 2026, Breast Check will begin accepting breast screening appointments for people aged 40 to 44. So once everything's fully implemented, so there will be over 80,000 breast screening mammograms available in Manitoba each year.
Okay, thank you so much, Leslie, for responding to that. And I think we have one last question here, except more people want to ask question. How do we get cancer care health educators to come out for an event? Kyra, would you be open to answering that question? Thank you.
Yes, so maybe we can pull up, is it on our website? We do have a request form for an event that you can find through our website. There you go. Make an education request. Okay, so you would fill that out with all of the information of your details, the type of attendees you would expect would be there, and then we would connect back with you.
Okay, thank you so much. All right, I don't see any more questions yet, so I am glad that we pretty much understood. And honestly, I want to say thank you to everyone here for joining this webinar. And please feel free to reach out to us if you have any question. Like we said, you could reach out to us at screening@cancercare.mb.ca, and we'll be sure to answer any of your questions. Okay. This is the end of it. Thank you once again for joining us, and I'm glad that we're able to get off before the time, so you have 5 minutes to yourself. Do have a wonderful day. Bye-bye.